Okay, guys. Today we're going to talk about abnormal behaviors and specifically abnormal oral behaviors. Okay, and go through kind of what is abnormal, things to look for, and kind of go from there. And we're going to talk about this specifically in our pets. And of course, for my examples, we're going to start with the horse and then talk about our dog. So when we talk about abnormal behaviors, what we're talking about is stereotypies. You'll hear some people are stereotyped. And then some people will call it vices, so either or. Typically, you'll hear most of your behaviorists, animal behaviorists, talking about it as more as stereotypy. But again, the most common one that you're going to see when you see these types of stereotypies or vices is orally related. So something to do with the mouth in some regards. And the reason why is that you're going to find, animals naturally on a regular basis are eating. Particularly, I'm going to start here with the horse because the horse is designed to eat 14 hours out of the day. So that's a lot of time spent eating. So if they're for example, today I have Val in her stall. If they're in their stall all of this time, if they don't have something to eat on, so you can see she's got her hay, which is a natural common thing. They eat, pretty much their diet is based off of forages. They can eat that 24/7. So if she doesn't have access to that hay, she's going to look for something to fill that void of that need, that desire to be eating 14 hours a day. Okay? So again, that's where we see horses in particular, a lot of those stereotypies are found in them because they're in a stall with insufficient access to, some type of forages, okay? The most common one, stereotypy that we see in horses is what we call crib biting or cribbing, where they clamp down with their incisors on like wood. It could be a metal. It could be like their feed bucket or water bucket. And they clamp down and they hold on it. And then typically it's combined with what we call wind sucking, and then they'll suck up, okay? So keep that clamp down and suck up. The big problem we get with that is if they clamp down on like wood, for example, if some of those shards come up as they suck up, that can tear up their esophagus, whatnot. I had a horse in our riding program at our university that was so bad, that cribbing instinct was so bad in her, even with access to, so we inherited her after she created that vice, that when she was out in the pasture and she knew she was hungry and she'd go to eat a round bale that we had out in the pasture, we had a metal around that round bale to kind of keep it in place. She would naturally then, even though she went to go eat that hay, would grab onto that metal and start cribbing instead of eating. So she literally was starving herself to death. Same thing, she knew she had to go drink water. She was thirsty. She'd get to that water trough, and that instinct was so dominant, she would go and grab onto, instead of drink, onto that side of the water trough. So you do have to be really cautious. This starts at a very early age. We usually see in younger animals. So Val, we inherited her when she was much older. And for her, she doesn't crib, but she has kind of an oral aggressive behavior. So naturally, if a horse feels threatened, they're either going to flight or fight, usually run away or whatnot. For her, even if she's not in a scary situation, she just may at points start showing aggressive behaviors with an oral type of personality. So if you watch, see how she's kind of pinning her ear? No. And you scratch, she's kind of fussy. Notice her biting, okay? So she'll bite on, she knows she's not going to bite me. And I'm not really pushing her off or anything. So what she does, she starts biting on the sides. So she gets frustrated. A lot of times you'll see her biting at the sides of her walls. So she's not cribbing. So she's not taking and clamping down with those incisors. So those are those front teeth here. So her incisors, if you notice, are in good shape. They're not worn down. A cribber will go down, will go down so far they'll start bleeding their gums. So she's not that bad. But again, like I said, it doesn't take much before she'll start getting into that instinctive response. And again, I'm scratching on her. Most horses, I have one that loves it. But for her, she'll start just biting at that side of that wall when she starts really getting frustrated. And so again, that's something you got to, and it's most of you notice it's just right here in this chest area that she started that instinctive, and that's what she'll do. And she knows, and like I said, I didn't really have to push her off or anything. So that again is that abnormal oral behavior. You'll see some horses in stalls that they don't have that forage. They'll start eating their shavings. And again, any abnormal type of food, like shavings isn't good for them. They'll start eating, chewing on the wood. So you may have a wood chewer, so it's not someone that's cribbing, but they'll start chewing on the wood. So even abnormal eating behaviors can be a sign of a stereotype or vice. Okay? So let's talk about, that leads me nicely into talking about abnormal chewing behaviors. Okay, so if you see here, this was my nice wicker furniture. And you can see now it's been chewed and destroyed. And you see one of my 3 culprits for doing that. So naturally as puppies, so again, he's now over a year old. But naturally as puppies, they will go through a chewing phase. Just like you have a baby will go through a teething phase. In dogs, we usually see about 1 month old, so 4 to 6 weeks, they'll start getting those milk teeth in, so those baby teeth. They'll get about 28 of them. So as they're coming in, so they're born without them, unlike with like your horse who is born with their teeth. So we don't go through that same teething related issue. But with puppies, they're going to actually, at 4 to 6 weeks, they're going to start to get those incisors coming in. So they got 28 of them coming in. So like a baby, you're going to find they're going to go through that period. Then they'll lose those 28 around 3 months. And then around 4 to 6 months, they get their adult teeth start coming in, and they've got 42 of them. So it does take some time. So you're looking at, almost up to 6, 7, 8 months, you might be looking at them going through those chewing behaviors. So what happens so chewing is natural. But again, what can happen is if you don't give them some way of going ahead, and in the wild, they'll find bones and things to chew on. If they don't have access in your home environment for chewing and chewing in a proper behavior, they start chewing on this other stuff. And again, that's one thing you got to look at is in your environment, just like we talked about with horses and that need, that desire to be constantly 14 hours a day eating. When these puppies are going through this chewing phase, again, if they don't have something, naturally they'll start looking for other stuff. Now, if this stays persistent, so like I said, he's now a little over a year old. When they start to get out of this chewing, this teething phase, and all of those teeth come in, if they continue to persist, now we've got a persistent issue. If they start eating on stuff that's not normal, and ingesting things, foreign bodies that aren't normal, that's where this has become a persistent problem, okay? So again, within our environment, we need to make sure, especially when they're going through this chewing phase, that we can offer them adequate types of relief for chewing as they get through those phases, okay? And I will admit, again, this was 3 dogs. I'd be a little more worried if it was one, that, we had our hands full with that, but he has definitely gotten through it. About the only thing we're arguing still about is he's got a pillow that he likes to tote around, but he's not eating it, so he's doing good. So he's gotten through that. So we create an environment that he can finally, eventually get his way, and him and the rest of our 3 were able to kind of get through that. But those are some of the things you've got to consider. You do also need to look when they start eating and chewing on abnormal things, still even chewing on his leash. You do also need to look at their diet. You'll find some animals will start chewing on stuff looking for some type of nutrient that they're missing from their diet. So you do want to make sure that their diet is complete. Consult with your veterinarian or a nutritionist to make sure they're getting everything that they need, because that can also be an issue there, okay? And you say, well, why is it a problem? First of all, then, if they're not getting a nutrient, then you may see that there's some deficiency. Hey, buddy, here comes this other culprit that likes to chew on stuff. If you find that they are missing a nutrient, they could end up not developing correctly, okay? So that's another problem. As you can see, here's one of our other culprits for chewing on that, an even bigger one. You can see that they've grown really well and whatnot. So they weren't missing any diet. You can also see nutrient-wise, If they're not getting like a mineral or vitamin, you'll see poor hair coat. You can see both of them have a great hair coat. They've grown to their breed's heights that they need. You can see their teeth really well and healthy. They have good nail growth, whatnot. So again, you can see that they are adequately growing like they should. So again, this isn't a lack of, their chewing was mostly based on teething. But you will look at to see if the diet, if there is an issue, that sign of them eating abnormal things is a problem, okay? So now one of the things, and that's why I picked him, and then Smokey decides he's jealous and he wants to be a part of it. One of the things you can get into a problem with is not only can they potentially have problems in your digestive tract, but you could, eventually, in an upset stomach, it may cause an impaction altogether, okay? It may block that digestive tract. For him, he didn't have a block, but what he did have was he got a hook caught in his mouth from trying to ingest on an abnormal things. And so, again, you always want to inspect what they're getting into, try to keep things away while we're going through that. But if you have an animal that naturally starts just eating random things or whatever, that is a huge problem, is worrying about that foreign body impaction in that GI tract. So how do you know if they've gotten in something? Now, the hook, we could see he didn't want to close his mouth. We opened it up and we could look at it and see. What we found we were able to inspect them. And that's one thing, is you want to inspect your dog on a regular basis, particularly as they're going through that chewing phase, to make sure that there's nothing in their mouth. So be able to look in their mouth, looking at palpating and feeling their body, okay? Again, one thing I would get worried about with these animals is if they end up where I'm palpating and they're sore, or they won't even let me palpate, the day that he doesn't lay over and want me to rub his belly, it's a sign that he may be sore in his belly, okay? But I should easily be able, so knowing your animal is so important. You also need to be able to, inspect them regularly and then be okay with it. So you notice I'm playing with their mouth and their teeth. One of the things I like to do is look to make sure that they have healthy gums, that they're nice and pink. Okay, so I want to look to see that. I want to notice that, is their nose nice and wet? Are they drooling excessively? That might be a sign of them wanting that need to want to vomit. Same thing, I want to watch their eating habits, okay? When this guy starts refusing food, that may be a sign he's uncomfortable. Or if he's overly trying to gorge, you might then try to decide, I'm trying to push something out. So again, I want to watch that. I even want to watch their defecation habits. So again, you may see diarrhea, it may be profuse diarrhea, or it may be constipation that you may see. Or on the flip side, it may be something where they're not only constipation, but they're constantly trying to find a place to go to the bathroom, okay? So you can see there's restlessness. So again, if he's having those related issues or rolling around excessively and won't let me palpate, those are some of the things. The other thing that you'll notice a lot of times is when they start to get bloated because they're impacted, is they'll have an unusual stance and walk. So they'll be kind of hunched over. So like if I have a stomach ache, a lot of times I kind of cramped over, kind of hunched over because I'm cramping up. So you'll notice they'll end up cramping in those hindquarters, may see it up even a little more elevated, and they'll start just kind of walking kind of in an odd gait. So that's something. But again, you need to know your dog and how they naturally present themselves to be able to tell if there's some issues there. So that's another problem that you want to look for. But it's very important when they're going through this teething phase to really kind of inspect to see and regularly that they didn't get something in their mouth. So looking in their mouth. And then also then inspect to make sure that they haven't gotten something digested in there, that there's an impaction. And then finally, from the abnormal basis is when they get past that last little bit, you can see he's got all of his teeth in. They're good to go. We don't have anything growing in there anymore. At that certain point, they should be getting out of that teething period. If they're not and it's persisting, then I need to really look at, is this an abnormal behavior? And if so, did it come from me not adequately providing? Maybe it's not the right nutrient. Maybe it's not the right, maybe I need to start providing them some dental chew bones. Maybe it might even be an oral related issue of healthy that I need to have inspected, by my veterinarian. But those are things that you want to look at. An animal really can't tell you all the time if there are health issues. You've got to be observant and then kind of figure out where they go. And that's one of the best things that you can do is knowing your animal can help. Having a great veterinarian is important, but the best way to guide it is knowing your animal and knowing what is normal and what is not. So you're going to chew on your thing. So again, making sure that they are healthy and normal and happy is something that's really important for them.